Now, talking about the therapies in heart failure, we have seen last 5 or 7 years have seen a lot of newer molecules. Those have come up in the therapy of heart failure. If you talk about heart failure management, and if you look at the treatment options that we had 5 decades back, or if you go through the textbook of Hurst five decades back, you will see the only therapies those were available were the mercurial compounds, which were used as diuretic agents and as an antisyphilitic agent in aortic regurgitation, and then digitalis. But today we have a list of armamentarium that is there, and they have not only improved the morbidity, but have also added up or reduced the mortality that is associated with heart failure. Talking about the most important molecule that has come up, that is ARNIS, the sacubitril/valsartan combination. Now, Paradigm HF was the trial, and it has changed the outcome significantly in patients with heart failure with reduced ejection fraction. Now, if we have to talk about this Paradigm HF trial, it was a randomized double-blinded controlled trial wherein the patients with chronic heart failure, I like to remind, these were the chronic heart failure patients and not the patients with acute decompensation. Those were randomized into two groups. Initially, they had a run-in period wherein they were treated with ramipril and seen for the tolerance or the ability of the patients to tolerate the ACE inhibitors. After a run-in period, patients were blinded into two groups, one group receiving ARNI and the other group receiving ramipril, and then they were followed up, and it was found that there was significant reduction in the primary endpoint in the form of cardiovascular mortality or heart failure hospitalization, that is total MACE rate in the ARNI group as compared to the ramipril, the ACE inhibitor group. So with this trial, it was pretty clear that when we add ARNI, it had significant improvement in the outcomes over and above those are provided with ACE inhibitor. So the Paradigm HF trial has brought a real renaissance in the management of heart failure management, and today probably ARNI is recommended in all the patients with heart failure, those who have no absolute contraindication for this molecule.